Now I call upon Dr. Chinnasami, President and Medical Director, to present at Brainchild Cancer GPS. Sir, the floor is yours.
Thank you for having me here today, and welcome everybody. Cancer is probably the single scariest word anybody can hear in their lifetime. It changes your life in a minute. It doesn't matter if you're the president of the country or working in the fields. The fear is universal. I've been doing this for about 23 years now, and the first thing I see in people is fear. The family is afraid, the patient is afraid, and most of the decisions, unfortunately, sometimes are guided by fear. What we also found was, once you have a cancer diagnosis, this is a journey you take for the rest of your life. It's not how long you live, whether it be a day or whether it be decades, it follows you. So as I proceeded through my career, what I found was we take so much time preparing for so many things. For example, a GPS when you're driving far away. We want directions. We want to be safe. What if there are detours? What if there are problems? What if you need gas? You want somebody to be able to guide you through that, and so you use your GPS. So the question becomes, since once you have a diagnosis of cancer and you're on a journey, why not create a GPS for the patient? So, if the patient feels in control, they're most likely going to comply with what they need. So, this is truly patient-centric. And the way this got started was not by me deciding what somebody needs, but by interviewing cancer patients. We heard their fears, we heard what they wanted, we heard what they really were afraid of, and built this program around that. And we have cancer survivors with us who can attest to the fact that once you have a diagnosis of cancer, lots of things change for you. It doesn't matter how smart you are, fear is paralyzing. So why not make it easier for the patient? The second thing we found was whenever patients come to see us for the first time, they barely remember anything we told them. Again, how do we prepare for anything? Even for an exercise class, people like to have personal trainers. So the first thing we decided to do, based on what the patients told us, was create information that's concise, clear, and patient-friendly. It's not for doctors, it's not for nurses. It's for patients and their families. And so when we created these videos, that's what we had in mind. So we got a lot of world-leading experts to come and do these short videos. And the purpose of the video is not to replace your doctor's visit. It's designed to enhance your doctor's visit. Because once you know what to expect, it's a lot easier to learn. The problem with doctors are we live medicine and sometimes don't have the sensitivities that patients need and talk too technically, we talk about them, and that's just the way we were trained. And because we talk to other doctors, we talk to other nurses, how much time do we get in our training spent to talking to patients? Very little. So the whole purpose of the video was to be prepared. And when I pitched this to these world experts, I was wondering, will they agree to do this? And when I explained my concept to them, I've not had a single doctor refuse to do this. None of them are paid to do it. What we wanted was have a conversation with the patient. And that's how these videos were created. I've thrown away more videos than I've kept because some people don't communicate as well as each other. So this is a process of building. I'm not going to tell you what videos we're going to have because I let the patients drive that. Similarly, a lot of problems come up with we concentrate on the patient and sometimes ignore the family. Let me tell you, cancer affects the whole family. It does not just focus on the patient. So again, the videos are extremely useful to the patient's families as well because it informs them in a very clear way what's to be expected. The second thing we really try hard to do is create a mentor program. A mentor is a veteran cancer patient who's basically gone through this journey and can then kind of advise another patient as to what to expect. Doctors and nurses can be empathetic, but only a cancer patient can really feel what somebody feels. And so, in today's day and time with technology, what we have achieved right now is two things. One, we can do face-to-face mentoring. But the second thing we are able to do for people who do not have the ability to do that is we can use things like FaceTime, Skype, just plain old email, or even just a telephone call. So this allows us to cover a huge number of people. And as we do this, it's not just for the patients. We also do this for the co-survivors, for the husband taking care of a breast cancer. It would be great to talk to another husband who's taken care of a breast cancer patient. So the whole goal is to be able to prepare somebody with somebody who's actually gone through this. The most important thing I think we should be able to take away from this is cancer is now becoming a chronic disease. That's a great thing to hear. People who lived a few months now live a few years. People who lived a few years now live more than a decade. The treatments have also got simpler. People who required things like aggressive treatments like bone marrow transplant for conditions like CML now can take a pill. So even though in the Hindu paper today it said that cancer incidence is increasing, but people are living longer. Now that sounds like a wonderful thing, and it is. But if you don't prepare for it, it becomes problematic. Because these are not patients who have not stopped their treatment. They continue on some form of treatment or the other. So we need to develop great survivorship programs. And I think that becomes extraordinarily important in coaching people how to live life. The single most thing I think any patient can have is be able to other patients on their journeys and serve as role models. The question now becomes, where do we go from here? And what we want people to understand is taking care of cancer is a team sport. It's not enough for the medical oncologist or the radiation oncologist or the surgical oncologist alone. We need a whole host of people. We need people who are nutritionists. We need people who are exercise physiologists. We need people who can give spiritual guidance. We require people who have pharmacological experience. It's a whole host of people that requires people to take care of them. Doctors are central to their care, but not the only people who need to care for them. There are a whole variety of ways that people can also use in terms of exercise, whether it be meditation, whether it be yoga class. The whole goal is to take care of the patient as a whole. Don't treat the cancer patient as somebody with a disease. They potentially have the will and want to live as long as any of us do. It is unfortunate to have a diagnosis of cancer because the day we are born, we are all terminal. But we don't concentrate on our death, we concentrate on our life. Similarly, we want patients to be able to concentrate on their lives. And so the most important thing we can teach anybody is that even though we can't cure all cancer patients, if we find things early, they clearly do uniformly better. So we have to encourage people to screen. We have to encourage people to quit tobacco. We have to encourage people to live healthy lives. And I think every patient and a family can be a guidepost. Direct patients to where they belong. And the critical thing in this is mobilizing survivors so people are not nihilistic and think that just because you have cancer, you have to die, and therefore not get screened. So I'd appreciate if every one of you take away this message. Please get screened. Please live healthily. And with people like Dr. Shanta here, we're going to continue having great cancer care. But let's try to prevent cancer even before it happens. We are now at a time where technology allows us to fingerprint every cancer. It allows us to predict who could potentially have cancer. We've reached a lot of technological accolades. What we need is the human element, and we need people to be able to speak to that. And I thank you for listening to me, and I would appreciate you guys looking at our site and give us feedback, because this is not my site, this is our site. And only if you tell us what works or doesn't work, there is no way for us to improve it. So I appreciate you all coming, and thank you very much.
Good evening to everybody. I'm indeed very happy. I'm honored to have been given the opportunity to be here in this meeting for the launch of the GPS, whatever you call it. Maybe I'm not right, but I first of all want to thank both the Dr. Chinnasami and who is the other one? Bernard. Yeah. All the people, the Lions Group people, for giving me the opportunity and the type of introduction that they have made. The fact is, cancer is a major health problem, and fortunately or unfortunately, I have been with it for 60 years, and so, and I know all the complexities and how the website is trying to help the cancer patient, because the cancer patient is not a patient alone. The cancer patient has a family. I think it is very necessary for us to take care not only of the cancer patient, but the entire family. Number one, that is very important. The next thing is, when a patient comes as a cancer patient to us, it is not enough that we treat him alone. It is not just the treatment of the disease, but I think his emotional needs have got to be met. I think this is one of the most complex specialties in medicine is oncology. And today the complexities are increasing because the panic that the word cancer produces continues despite all the advances that have happened. And it is our responsibility to see that we dispel this panic, we dispel the myths about cancer. How do we do it? One of the ways is the launch of the website, where they try to give the information that is needed, they clear their doubts, etc. But what we have been doing, of course, in India, in our own environment, we have been doing this also, and I think we are very happy to be associated with the GPS. Now, what is cancer? Why is the panic about cancer? Why are they continuing? It is all right, I always tell them it is all right. They had a panic in 1954. When we started life, when there were minimal facilities for cancer, there was minimal understanding of cancer. Today, the advances are phenomenal. And in spite of it, the panic continues. It's again a lack of awareness of the individual, of the community, and because of that, the panic continues. They don't know what is cancer. They don't know that cancer is not a single disease. They must understand cancer is not a single disease. No two cancers are alike. I don't think I need to go on talking about cancer, but I think very important to say, with the advances in cancer treatment, our survivors are increasing. Now we are increasing our survival. People, not only survival, quality survival, which is more important than survival. Now today, beyond survival, we are going on to survivorship. We are going on to healing. It is not enough if you treat them, if you cure them, you have to heal them. That healing is something very different from cure. This understanding of the oncologist is vital if we are going to conquer cancer. That is one. The other thing is, now, in spite of all advances, we still have late disease, we still have lack of awareness. So what do? The thrust today all over the world, even the most developed countries, is prevention. Prevention is better than cure. I think towards this prevention, again, we need these awareness programs and the programs that give the patients and the community at large whatever information one has to know. I think they must be provided the information clearly. Very important in oncology, the communication skill, which is important and vital. And the question of listening to the patient, listening and communication, two things are going to be vitally important in taking care of our patients. So I think the effort that the GPS has done, I think, and we are very happy and proud and honored to participate in the program. We hope that we will have a continuing one. Just this before I came here, I was telling, I don't know the name, the person, that India is not spending adequately on cancer, and I think we should do more as a community. I think the people must rise up and say that we need to do more for cancer. 50% of cancers today, cancer of the cervix, the tobacco-related cancers, are preventable and curable if they come early. Pediatric cancers are curable today. So this can be said with great confidence, because we have seen the change from 1954 to today. Down my memory lane, I know of many of my children whom I could have cured today. So this message has to be carried, and I am very happy to be part of the program. Thank you.
I'm very happy to tell my experiences of treating patients for the last 25 years in the Indian system of medicine, where I have seen a number of patients suffering from cancer. But today, I would say a humble beginning, which is for the sake of mankind, by Dr. Bernard Chinnasami. In Tamil, we say Chinnasami means small God. But here he is no longer Chinnasami. His Periyasami means God of gods. He has got a good message, a good heart. And a good message to everybody is, cancer, don't treat it as a disease. It takes away your ease. So it is disease. But if you think of cancer as a disease, you will be always afraid, scared, and you will run towards a failure. It's just a metabolic disorder in the body, which is born the very minute you are born on this earth. But it surfaces out at a certain time, and at that time we call it the primary stage. Do not be scared of cancer, because I always said a simple theory, that is the disease chronic or are we chronic? It is the fear that makes us the disease as chronic. The disease will go away immediately when you have a confidence, one, in yourself, two, on God, and three, the person who is treating you. He is a messenger of God who comes before you to say that cancer is just but a disease which enters into you because of your certain habits. Don't regret what you have done. Have confidence that it has come and its exit is also there, and you will be cured. Death is not the end of cancer. Death is definitely not the end of cancer. Cancer can be treated with confidence, self-confidence, and above all, when you find this cancer as a diagnosed in your system, I would always advise people not to be thinking about it and think that they have to have a good meal and a heavy meal. No, it's not that. You should avoid dairy products like milk, and I connected with milk, yogurt, so that there is no lactose which goes in and starts disintegrating. There is advancement of cancer over the last 50 years is phenomenal. Non-invasive also has now started coming. Nuclear has made a big dent, but I, in the practice of Indian medicine, always said, faith in you, faith in your doctor, and faith in God. This is called cancer has no place in your system. It will be expelled as fast as it came. The easiest way is to detect. When detected, don't go into a panic mood. Just accept that, yes, it is diagnosed. Now the exit of it, the doctor will do it. My message to everybody is, you should think how near and dear are you to God. When you think that you are near and dear to God, God doesn't want you to suffer eternally. This is just a beginning. Let the doctor do the middle part of it, and your constant faith in God and constant faith on yourself will see that cancer does not exist as long as you can presume it to be. This is my message to everyone, and I once again congratulate the people who have come onto this planet Earth as a messenger, bringing this GPS system. Right from your laptop, you can see and answer such questions that you don't have an answer, but they have an answer, which is posted on the website. Please go through that. Don't go through panic, and I'm sure you will conquer cancer. Cancer cannot conquer you. God bless you. My heartiest congratulations to you that you are taking the message of God to the world.
Thank you.